Hello, I'm Ben.
And I'm Paula.
And like you, we're registered dental practitioners who have obligations we must meet in order to remain registered.
And today we're going to tell you what those obligations are.
Meeting your obligations is important to help keep the public safe. Paula and I will now give an overview of what your obligations are under the Health Practitioner Regulation National Law, or what we commonly refer to as the National Law. The Dental Board of Australia, which registers dental practitioners, publishes its registration standards, guidelines, codes and policies on its website. These documents will help you understand your obligations, so it's important that you know them.
All registration standards can be found on the board's website, and while they are all important, we'll talk about a couple of these today. The Continuing Professional Development Standard requires you to complete a minimum of 60 hours of CPD over a 3-year CPD cycle. A registration standard often has a complementary guideline to help you. The CPD guideline will help you to meet the registration standard.
Another standard is the Professional Indemnity Insurance Standard, which sets out the requirements for this type of insurance. As well as the registration standards and guidelines, the board publishes codes and policies which you must follow to provide safe care to your patients.
The Code of Conduct helps and supports registered dental practitioners to provide care to patients safely and ethically. The code is a really important document to be familiar with.
It is your responsibility to follow this guidance, which helps you meet your infection control obligations, including being aware of your bloodborne virus status, advertise your health service, maintain dental records, use social media, and meet all other board requirements.
Registration standards, guidelines, codes and policies may be considered if a complaint is made about your health, your conduct or your performance.
Dental practitioners must only perform those dental procedures for which they have been educated and trained and in which they are competent.
Every year, when renewing your registration, you must confirm that you've met or will meet the board's registration standards. You will be asked to make a number of declarations, including whether you've met the CPD requirements and that you commit to meeting the Professional Indemnity Insurance Standard. You must also disclose if you have a health impairment or have had any complaints made against you to a registration authority or a complaints entity. You must ensure that you carefully read all declarations and respond honestly. Submitting a false declaration may result in action being taken against you.
In addition to the events already mentioned, you must advise the board in writing within 30 days if your principal place of practice or name changes.
You may be randomly selected for an audit at any time to check your compliance with the registration standards. So remember to keep a record of your professional indemnity insurance, CPD and employment history.
The Dental Board of Australia and AHPRA work together to keep the public safe. It is your responsibility to be aware of your obligations to practice safely. To find out more about your obligations, go to the Dental Board of Australia website at www.dentalboard.gov.au.